Hello and welcome. My name is Dr. Veselina Galancheva. I'm a clinical fellow with the Department of Psychiatry at Children's Health Ireland at Crumlin, or formerly known as Our Lady's Children's Hospital. I work alongside Professor Fiona McNicholas, a consultant and professor in child and adolescent psychiatry. Together we have developed a number of presentations on mental health and 22q deletion syndrome. The focus of this presentation is on psychosis. I'm just going to take a moment to start sharing my screen before I continue, if that's okay. So let's, to begin with, let's talk about what is the definition of psychosis. The word originates from the Greek word psych, which means mind, soul, or breath, and the suffix osis, meaning illness. So broadly speaking, psychosis is a state of mind when the person loses touch with reality and has a feeling of something being different from normal. In many cases, but not always, a psychotic episode is preceded by subtle pre-psychotic changes, or as we call it, a prodromal phase. For example, these changes could include sleep disturbance, mood fluctuation, increased anxiety, difficulties focusing, increased sensory sensitivities to light or sound, confused thoughts, having odd ideas and preoccupation, feeling suspicious. So recognizing the psychotic phase is not always possible, as you can see the signs are very general and may point towards different things, including ordinary adolescent behavior. It is often diagnosed just after the psychotic episode develops. What are the symptoms of a psychotic episode? During this time, the person finds it hard to distinguish what is real and what is not. Psychosis has an effect on the person's thinking, on their behavior, and their sensory experiences. The individual may not actually always have insight into what's going on, and or they might only have a complete kind of partial understanding that something is going terribly wrong for them. The thinking may appear quite confused. The person might have some unusual beliefs, and the content of these beliefs could vary. For example, they might think that someone is against them, trying to cause harm, plotting against them. The person might also have unusual beliefs about the nature of their own thoughts. For instance, thoughts being put in their head, being read by someone else, being broadcasted or interfered with in some way. The whole thinking process could appear jumbled up. As a result of the unusual thoughts, the behavior changes. The individual might be checking around the house. They might give unusual meaning. They might attribute unusual meaning to things or events. Having sensory experiences or hallucinations is another of the symptoms of psychosis. All senses could be affected: hearing, seeing things, having unusual sensations on the skin, for example, as if an insect are crawling on the person's body. I experience, or they might have an unusual kind of smells or taste. Hallucinations are not only specific to psychosis. They might be a manifestation of other conditions, such as epilepsy, for example, delirium, or other organic illnesses, and seeking an urgent medical opinion is imperative. Psychosis could also manifest by less obvious symptoms, or as they're called, negative symptoms. The negative symptoms include social withdrawal, loss of interest and motivation, diminished self-care, little expression of emotions, reduction in speech, difficulties in thinking or coming up with ideas. The presentation is really variable from person to person, and the symptoms may appear abruptly, but more often they have a subtle onset, evolving over time, sometimes over months and a year. So in terms of the difference between psychosis and schizophrenia, because sometimes they're used interchangeably in the society, I just want to kind of clarify that there is a significant kind of a difference between both. Schizophrenia is a chronic enduring mental disorder of reoccurring psychotic episodes. If left untreated, there is a risk of deterioration between episodes and gradual functional decline in the individual. However, with treatment and engagement in a rehabilitation program, the outcome for the individual could be quite good. What are the risk factors for developing psychosis? Having there is a strong genetic predisposition, and similarly to anxiety, depression, and also diabetes, high blood pressure. Having a first-degree relative with a psychotic illness increases the risk to 10 to 15% of the individual developing psychosis themselves, or having a genetic condition such as 22q deletion syndrome, Prader-Willi syndrome, and some other microdeletions also increase the risk. Various drugs of abuse can trigger what we call drug-induced psychotic episode in vulnerable individuals. The list of drugs includes cannabis. The link between cannabis and schizophrenia is well established in research. Amphetamines, LSD, club drugs such as ecstasy or MDMA, cocaine, alcohol. Brain trauma during birth or later in life could also increase the likelihood of developing psychosis. Psychosis could be the first manifestation of a brain infection or a tumor. And last but not least, extreme level of stress, anxiety, sleep deprivation are also among the risk factors. So what is the prevalence of psychosis? In the general population, psychotic disorders have a lifetime prevalence of about 3%. Psychotic experiences, on the other hand, can occur outside the context of a full-blown psychotic disorder, and studies report approximately 5% prevalence of psychotic experiences reported by by adolescents and children in their late childhood years. But these young people don't necessarily develop psychosis later in life. Between the age of 18 and 24 is when usually the symptoms occur. But in most cases, between the age of 13 and 30, we'll see some symptoms in people who are to develop psychotic illness. So the research in the 22q population shows that about 25% of the individuals would experience a psychotic disorder in their early adulthood. Therefore, there is a need for building up awareness, and so that treatment could be offered in a timely manner, and the prognosis, when the prognosis is much better. There are some steps that could be taken to minimize the risk of developing psychosis. Keeping healthy routine of balanced diet, regular exercise, looking after the physical and psychological health, abstaining from any substance use. All this may not prevent the occurrence of psychosis, but would improve the outcomes for the individual. How a psychotic episode is going to be treated is decided after a comprehensive psychiatric assessment. In the acute phase, when the behavior is erratic and the experiences are quite distressing, a pharmacological treatment is usually prescribed. After the acute phase, a more long-term plan could be made in collaboration with the individual and the person. In the phase of recovery, it's really important to emphasize again on healthy lifestyle and increase social and family support. It's important to remember that actually receiving treatment in a timely manner really improves the outcomes despite the chronic nature of the psychotic illness. If you would like to read a little bit more and get a little bit more information online on this topic, the Early Psychosis Intervention Canada website provides excellent resources. The books, if your adolescent has schizophrenia, and the Schizophrenia Family Guide are highly rated. In the end, I would like to encourage you to look after yourselves and seek help if you're struggling. I would be grateful if you give us your feedback and complete the feedback form that you can find on the 22Q Ireland website. Thank you very much for listening.